We have 5 categorical surgical residents in our program, and then we usually also have 3 or 4 preliminary interns every year. The residents do a broad mix of general surgery rotations across the spectrum of types of cases, so they get a really broad mix of cases and different types of rotations, from vascular surgery, endocrine, surgical oncology, trauma, critical care, pediatric surgery, really the depth and breadth. We have a burn rotation and we have a transplant rotation, so we really have pretty much every rotation that the surgery residents could possibly need for their training. The patient population here in New Orleans is somewhat unique. Our residents really get to take care of a broad spectrum of patients. We don't have very many fellows, so our residents really don't have to fight to get the big cases, the awesome cases. So the chief residents are doing the Whipples and the esophagectomies and the big trauma cases. So that's something that most of our residents have really this is one of the things that have drawn them to our department. You're going to get to do amazing cases, and you're going to get to see the unusual things that a lot of people don't even ever get a chance to see in training. But our residents also go to community hospitals in the area and do a lot of bread and butter general surgery. So they get a very high volume case experience. Most of our residents graduate with between 1,100 and 1,200 major cases. There are a lot of research opportunities in our department. We do a fair amount of research in trauma, in surgical oncology and endocrine surgery, in surgical education, in minimally invasive and bariatric surgery, in transplant surgery. We have both basic science and clinical research opportunities. We do not have a dedicated research requirement. There is an option to do a dedicated research year or 2 for residents who are interested in that. It's not something that you have to sign up for when you match. It's just something that as residents become interested in it, we try to figure out how to fit that into their clinical experience. So if you're interested in doing a research year, we have a couple different options. Some residents choose to stay here and do their research at Tulane. Some residents choose to do research somewhere else if they're really interested in doing pediatric research or surgical plastic surgery research or something like that in a specific specialty at a specific other institution. We can arrange for residents to have that experience as well. Our graduates have gone on to all different kinds of fellowships over the years. We have a list on our website that you can look at that goes back to a year or so after Katrina. But in that time frame, the past 15 years or so, our residents have gone into pretty much every specialty you can think of, be it pediatric surgery, trauma surgery, plastic surgery, really the depth and breadth of all the different types of fellowships. We feel very strongly that all of our graduates could go into general surgery private practice if they decided to pursue that. The culture in the surgery department is something that we're really proud of, that we've been very intentional about and thought a lot about how we want it to be. So it's something that we actually talk about a lot. We really do treat each other like family. I know a lot of places say that, but I really wish that you could come here and we could meet you in person and you could see it for yourself, because we really do live that every day. I would say the most important thing for applicants for our program is that we really want somebody who's going to fit with our culture. We want people who are passionate about taking care of patients. We want people who are going to be passionate about taking care of each other and understand that we are a family and that we're all in this together. We want to help each other learn and help each other grow. Some of the pillars of our esprit de corps are each one teach one. That's extremely important to us because everybody can teach everybody else something. And as you grow throughout your residency, you will teach medical students, you will teach junior residents. You may teach me something as your program director that I didn't know before. So it is very important that we want you to grow as a teacher as well as a surgeon, so that you can be the best surgeon that you can be, and you can educate your future patients, your future residents or students if you stay in academics, and your patients and their families. So in summary, I'm really excited that you're interested in the residency program at Tulane for general surgery. Whatever you want to do, whatever career path you want to choose, we are committed to helping you get there because we want to be the best you can be. We're a fantastic residency program, we're a great place to be from, but more importantly, we're a great place to be.